Hi everybody, it's Adam with HeartValveSurgery.com, and we are answering your questions live at the Heart Valve Society in Abu Dhabi, and I am thrilled to be with Dr. Rakesh Suri, who is the president of the Heart Valve Society. He's also the CEO of Cleveland Clinic in Abu Dhabi, and also he's the chair of thoracic and cardiovascular surgery. Dr. Suri, thanks for being here with me today.
Thanks, Adam. It's a pleasure.
Yeah, and so we're going to get right into a question that came into, because I know it's in your sweet spot of what you do, which is mitral valve re-repairs.
Yes.
And I understand you've written, published a paper perhaps on this topic as well. But the question comes in from Steve, and he asks, hello Adam, do doctors specialize in mitral valve re-repairs? I had a mitral valve repair done 23 years ago and will need surgery soon.
Great question. So mitral valve repair is so common for a condition known as degenerative mitral valve disease or mitral valve prolapse. We have literally hundreds of thousands of patients who have had this life-saving procedure, and the failure rate is very, very small. For posterior leaflet repair, it's about 0.5% per year. For anterior leaflet repair, it's about 0.8% per year, and when both leaflets are involved, it's about 0.8 to 1%. That's the great news. So the chance of requiring a reoperation is very, very small. When it does happen, we have the expertise available. So while you choose a mitral valve surgeon and a repair team that has published, documented long-term outcomes that can duplicate these standards, you have to be super careful when you choose a re-repair surgeon, because not every surgeon will look at the valve like a piece of art or a precious cloth that needs to be saved and repaired. And that's important because the opportunity to save good, healthy tissue, even though the valve has been repaired before, is extremely important to optimize patient outcomes, survival, and free patients from the chance of needing blood thinner. So choose your repair surgeon carefully, for sure. And then when it comes time for re-repair, in the minority of circumstances, choose your re-repair surgeon and your re-repair team even more carefully. But to your point, it is a science and it's an art, and it's a well-documented one. We can re-repair the valve upwards of 50% of the time. And we've found in our research that in 50% of cases, the sutures or the devices that we put in the first repair have either failed or the disease has progressed. Both of those things aren't anybody's fault. They just happen. Things wear out, mechanical shearing forces. But when it comes time for the valve to be addressed again, please show your case to a re-repair surgeon.
Yeah, and so I guess one of the questions, Dr. Suri, that is on the mind of this question of the patients out there is, how do I know if my surgeon is a re-repair specialist? Yeah. How would I know that?
It's a very good question. Just be honest. I think in the past, people worried about hurting the feelings of their medical team and wondering if it was about loyalty. In the modern era, that's just not the case. Everything is transparent. Conversations are forthright. They're logical. They're emotionless, and they're fact-based. And each team should have their data that they have in-house, that they report to the regulatory bodies. In our circumstances, the Society of Thoracic Surgeons, American Association for Thoracic Surgeons, and ACC. So the data exists. You can politely just ask your surgeon and your team to share their data about primary repair and re-repair, and that'll inform your decision very nicely.
Great. Well, Steve, I hope that helped you. I know it helped me. And again, if anybody's going to advocate for you, it is going to be you. Ask those questions that you need answers to ensure that you get the data and the reality about that re-repair specialist. Dr. Suri, again, thanks for being here with me today. And as we always say here, keep on ticking.